Welcome back to CR Arthritis at the Canadian Rheumatology Association and Arthritis Health Professions Association annual scientific meeting. Today I am joined by fellow Arthritis Research Canada trainee Saania Zafar, who has presented a poster very recently that we're going to ask her a little bit about. So Saania is a master's student at the University of Calgary studying community sciences?
Health sciences, yes.
Community health sciences, thank you, under Dr. Barber. And this was a project that I actually had the chance to interview Dr. Barber about a year back, so I'm really excited to see and hear some of the results. Now with that, can I ask, how did you come to work with Dr. Barber, and how did you, land in your master's? Like, what made you come to rheumatology?
Awesome. So I have familial experience with rheumatoid arthritis, and growing up, going to appointments with family members. I was always interested in arthritis. My undergrad was in community rehabilitation and disability studies. So not very related to rheumatology at all, but I was looking at what am I going to do after this? And I was reading some of Dr. Barber's papers. I ended up emailing her. She got back to me, and then I ended up being her master's student because she presented me with a couple projects. And the one I really, really liked was this pilot study. So that's kind of how I ended up where I am.
It's amazing. And yes, I remember my encounter with Dr. Barber, and she seemed like she is just an incredible supervisor in every way. So very nurturing, and I think that's important. So for us as trainees, we go through this interview process where we pretty much just send out cold emails. That's what I call it. Like a cold call. You send out cold emails, you cross your fingers, and you pray that someone will get back to you, and they're interested and they have capacity to take on a student. So tell us about this pilot project. And I'm going to preface this with pilot indicating before you do a full scale, what we call a randomized controlled trial, the kind of, not say best practices, but the way to do it, we've been encouraged, is to do a pilot study. So a smaller size study to ensure feasibility. And then we move on to that larger study. So tell us about this pilot study.
So we piloted a text messaging platform between patients and healthcare providers, in which patients were able to directly text their healthcare providers about rheumatology-related concerns. It was around 6 months long, and we had monthly "How are you?" text messages that went out on behalf of the providers to patients, and they were really allowed to reply however they wanted. There was no list that they had to choose from, and then that was sorted, and it was reviewed by the healthcare providers, and then they were able to respond if needed and not respond if not needed. And then after that, we just did a qualitative aspect where I interviewed a bunch of patients and kind of sought out their experiences and perspectives regarding the pilot study.
So you're listening to this and you're thinking to yourself, wow, I text. Wow, that seems really convenient. And my rheumatologist would actually respond on the other end. Doesn't that sound amazing? Because I feel like as a patient, one day I'll wake up and have this super itchy scalp. And I almost feel like there's some level of psoriasis, some skin eczema that's going on. And I'm like, do I call my rheumatologist? Is this worth it? Or will it go away in a few days? So it's nice to be able to ask those questions. Or perhaps it was something. And to be able to ask questions. So you then are able to decide and not wait to see.
Exactly.
So I know what I would have thought if I was in this intervention. Tell us some of these qualitative results where you interviewed people.
So what we found is patients really, really like the platform. They said it was timely. It kind of got rid of that phone tag you often end up playing with your healthcare providers where, you call them, you leave a voicemail, you wait a couple days, you call them again, leave a voicemail again, and then you wait, and then they call you, but then you're not at your phone. It kind of, gets rid of that whole middle process. Patients found it to be effective. They got what they needed. And they also found it to be efficient. So they were like, oh, this is so much easier. And some of them even talked about how if they were able to do this, the smaller concerns they had could be dealt with over text, which would then free up time for physicians, for them to take on new cases or for them to, bring in urgent patients. And the thought process was that, if we all partake in this, then when any of us need an urgent appointment, we can actually get it. And it's not like, you need an urgent appointment now, but your urgent appointment gets pushed to like 3 or 6 months even out. So it's more so just about like using your resources and kind of figuring out where to put what.
Yeah, and it's not that, and I like this model because it's not that we're trying to add more resources, right? So this is a system where we're trying to innovate in terms of how do we distribute our resources. And it's smart because you're not adding more to the system, you're not demanding more of the system yourself, you're just distributing differently.
Yes.
So, and what is something that perhaps you were surprised patients told you, where you're like, oh, I didn't think about that?
Well, just like they're like how conscious they are of this whole like process of care, and not just care, of education as well, because a lot of them mentioned they're like, like this is so cool, like I love it, but they're like, how will medical students learn, right? They were like, my doctor so-and-so, they have medical residents that come in and sometimes they are looking at me and doing the whole examination and things. So like just how cognizant they were of like, I really do like this, but at the same time it would save the doctor a lot of time, but then also thinking like, how will this impact the future generations, right? So just like how like conscious they are just of everything.
Yeah, and it's beautiful to see that, because then your uptake is going to be higher. You know that your patients want to save time for the rheumatologist, want to save time for the admin staff, right? If you have everyone in the system pitching in, I think, then we'll get somewhere.
Yes.
Amazing.
Exactly. And yeah, it was just very like, we had a shared model of care, like everyone seemed to really appreciate what we were doing, so very nice.
Well, thank you for that, Saania. And
of course.
I'm going to turn to Anita. Any questions, Anita? No questions. Okay, I will add one more.
All right.
So, from this study, now you have a pilot.
Yes.
What are you going to change? What is something that you're like, okay, I think our next step is to do a little bit more of this type of evaluation, or we're going to go through tweaking?
All right. So right now, we are going to evaluate the provider perspectives now, healthcare provider perspectives. And we're not just going to interview those that were part of the study, but also people who are, hesitant or only like slightly involved in the study, because in order for implementation to work, you do need like more than just one stakeholder group to be on board with it. So although patients like love it, if healthcare providers are like, please never introduce this, like it would be very difficult to, implement that, because there's so much pushback from like a whole stakeholder group. So our next steps would just be to, go through those interviews, code those interviews, and then just like draw out their themes and like what they think of this whole process.
Yeah, so important, right? Because you're getting not only the perspectives of the patients who love it, I can assume they do, but also the providers who are providing the responses on the other end. So really important. I'm excited to see those results. So you have to, I'll link up with you when you're done coding.
Yes.
And with that, we're going to thank everyone for their time, and we're going to thank Saania for being here with us.
No worries.
And with that, we'll see everyone at the next session.
Yes.
Take care.
Bye.
Bye.